Hey guys, Andrew here from Chiro Chiropractic Wellness Center. Today on the Chiro Couch, we're talking about sciatic pain. So first of all, what is sciatic pain? Now you may have had this, or maybe you've had this pain down the leg. It could be worse when you're sitting or leaning forward, or if you stretch your hamstring and you get this burning sensation down your leg. It could be tingling when you've been sitting for a long period of time, or when you've been sleeping in funny positions. Some of you might even notice a numbness or a weakness when you move your leg, getting in and out of the cars. It could be constant, but it also could be intermittent, which makes people not want to go get it checked straight away. But the biggest problem when that shooting pain hits you, and it's unrelenting when it hits you. There are lots of triggers though for sciatica basically. So that irritation of the nerve as it exits the spine is the most common reason for it. Vertebrae might be compressed if they're out of alignment. You might have those spinal joints jamming on top of each other there. You might have other serious issues like a tear to the disc or a prolapse to the disc. You might have degeneration of the disc because you've had long-term dysfunction that's caused by reduction of the cushions of the vertebrae. There could be a condition called a spondylolisthesis where the vertebrae actually slips forward on top of each other. That's one you want to diagnose properly. Or you might have the piriformis muscle pushing on the nerve as it wraps around the bottom of the spine there. A lot of people who haven't been exercising or not been looking after their weight, ladies with their high heels, or even you pregnant ladies out there who have got a lot of strain on their ligaments and their muscles are overdoing them, you guys are prime candidates for having these issues. But at the end of the day, we don't want that leg to feel compressed or paralyzed when you're walking around, sitting, sleeping, and all that stuff. It can be unrelenting if it gets worse. So the most important thing when we talk about sciatic pain is we've got to diagnose it properly. All right. Now, if you don't have a professional diagnosis, this could hang around for longer, which means the longer you have it, the harder it'll get for it to be fixed. So at Chiro Chiropractic Wellness Center, we make it affordable to have these things checked. It's just $29 for our initial consultation, and what you'll get is a thorough investigation to see if you have sciatica, piriformis syndrome, disc issues, etc., etc. But you know, once we work out what you need to do, there are lots of individual ways of how to treat it. We look at spinal manipulations. We might look at spinal traction. There'll be some exercises, some stretches, maybe even some strengthening exercises. But at the end of the day, we want you to get this fixed straight away. So if you've just got sciatica right now, what I want you to do is put an ice pack on the side of pain, just at the lower back or on the buttock. And I'm going to put a link below. It's called a piriformis stretch. And we're going to see if that helps you. And if that doesn't help, then I want you to contact our office. Now we're putting this out to our Facebook page, we're putting this out to our YouTube channel, we're putting this out to our current patients, so you can send this to your friends if you think they have piriformis syndrome or sciatica, etc. But ultimately, at the end of the day, your spine is so important. I want you to look after it as best as possible. So don't take this for granted. Action today. Do some of the stretches that we're going to post below. But if that doesn't help, I want you to call our office, get one of our lovely ladies to get you booked in to see me. And if I can't help you, I've got a lot of friends who in other professions can help you as well. So that's it from me today. Hopefully that explains sciatic a little bit better for you there. It's a fairly complex structure in a small period of time. But that's Andrew here from Chiro Chiropractic Wellness Center. Bye for now.